Welcome back to Breathe Easy, the short, evidence-based respiratory micro-learning design for bedside clinicians within ECU Health. Today we're talking about something many respiratory therapists are already doing without even realizing it. This topic is quality assurance and quality improvement, often referred as QA/QI. A recent article in Respiratory Care highlights how respiratory departments across healthcare systems are actively improving care through structured quality initiatives. These projects focus on applying existing evidence to improve clinical processes rather than generating entirely new therapies. And many respiratory teams are already performing quality improvement work every day through protocols, workflow changes, and bedside practice improvement. And I felt as though this was the perfect addition to our Patient Safety Awareness Week. So happy Safety Awareness Week to everyone. Quality improvement is fundamentally about patient safety and better outcomes. Healthcare organizations rely on these initiatives to identify errors, standardize clinical practice, improve efficiency, reduce complications, and strengthen evidence-based care. Respiratory therapy plays a major role in this process because we manage therapies that directly affect ventilation, oxygenation, and airway safety. And quality initiatives can happen at several levels within healthcare systems. A system-wide initiative, a department-level respiratory project, or a grassroots improvement driven by frontline clinicians. And many of these things that respiratory therapists already do, such as protocol development, ventilator weaning strategies, or high-flow nasal cannula management, are examples of quality improvement in action. The terms quality assurance and quality improvement are often used interchangeably, but they actually represent slightly different approaches. Quality assurance focuses on maintaining standards. It is generally reactive. A benchmark is established, and when care falls below the threshold, action is taken to correct the problem. Once performance returns to the acceptable standard, the intervention may stop. Examples include compliance metrics such as ventilator-associated events or documentation standards. Quality improvement takes a broader view. Rather than simply meeting threshold, quality improvement focuses on continuously improving care. It aims to move the entire system toward a better outcome through repeated cycles of evaluation and change. Many healthcare organizations combine these ideas into what is called a QAPI, Quality Assurance Performance Improvement. This approach emphasizes system improvement rather than blaming individuals for errors, supporting a culture of learning and safety. One of the most common frameworks used in healthcare improvement is the PDSA cycle, which stands for Plan, Do, Study, and Act. During the plan phase, the team identifies a problem and creates a measurable goal, often using the SMART framework, which is specific, measurable, achievable, relevant, and time-bound. In the Do phase, the intervention is implemented. For example, introducing a respiratory therapy-driven spontaneous breathing trial protocol. Next comes the Study phase, where outcome data is analyzed. So for example, did the ventilator days decrease or did extubation success improve? And finally, in the Act phase, the team decides whether to adopt the change, modify it, or abandon it. This cyclical process allows healthcare systems to continuously refine patient care. Quality improvement depends on data measurement over time. Two commonly used tools include run charts that track changes in outcomes over time and help identify trends or shifts in performance, and then control charts go a step further by using statistical boundaries to determine whether a change represents true improvement or normal variation. These tools often used to evaluate respiratory care initiatives like ventilator days, high-flow nasal cannula duration, bronchodilator utilization, or ICU length of stay. And these measurements allow teams to determine whether a new protocol is actually improving patient care. One important point that is sometimes overlooked is ethical oversight. Even when a project is considered quality improvement, it should still undergo Institutional Review Board review or determination. The IRB evaluates projects involving human subjects or patient data and determines whether the project qualifies as formal research requiring oversight, a quality improvement project that may qualify for exemption, or a project requiring additional ethical review. Seeking IRB determination protects patients, clinicians, and institutions and ensures that projects follow appropriate ethical standards. It's also important because many journals and scientific meetings will not allow publication of a project if IRB review was not obtained beforehand. So even when a project seems simple, the safest approach is to submit it for IRB determination before starting. In order to complete this process at ECU Health, you have to complete the city modules that are affiliated with Brody School of Medicine. If you would like more information on that, please reach out to myself or Zach and we'll be able to get that started for you. Respiratory therapists are uniquely positioned to lead quality improvement efforts. The literature provides several examples of successful respiratory-driven initiatives, including bronchodilator protocols, high-flow nasal cannula management pathways, airway clearance protocols, and extubation readiness testing. These types of initiatives have been shown to reduce ventilator days, ICU length of stay, unnecessary therapies, and overall healthcare costs. When respiratory therapists drive protocols and evidence-based pathways, patient care becomes more consistent and more efficient. Quality assurance and quality improvement are not just administrative exercises. They are powerful tools for advancing respiratory care and improving patient safety. Every protocol, pathway, or workflow improvement has the potential to become evidence that strengthens our profession. And many respiratory therapists are already doing this work every day. The next step is simple: measure it, improve it, and share it. Quality assurance and quality improvement are powerful tools for advancing respiratory care and strengthening patient safety. Every protocol, pathway, workflow improvement has the potential to become evidence, and that improves outcomes for the patients we serve. Thank you for joining this episode of the Breathe Easy podcast. Happy Patient Safety Awareness Week, and until next time, keep learning, keep improving, and keep helping our patients breathe easy.